Hello, everybody. This is Talia Frazier. I am your instructor for the Introduction to Public Health. So I am doing videos for the lectures and going over that. Let's see. Just want to make sure we're doing closed captioning. Okay, all good. Alrighty. I'm going to be sharing my screen with you guys. So I hope everything, the volume and all of that, you can hear me okay. Okay, so when you go into Canvas, I will have this in the module sections. First, well, this is the class. And I'm going to be adding more on here, but this is going to show up as published. I have not published this yet. I am doing a recording ahead of time, so you guys have it for each week, each time you do the module. I did a video prior to this one on the syllabus, okay? And please make sure you watch all the videos and the lectures and things like that, okay? So there's always going to be a page on your module which will tell you like a walkthrough of the module, what to do, kind of to do checklists, okay? So I like to get started because I don't want to spend a lot of time on the lecture for today. It's going to be on chapters 1 through 5. So each week we're going to go through 4 chapters, sometimes 5. They're very small chapters. Yes, it is a lot of information, but we are in an eight-week course, okay? So it's pretty fast paced, but you guys will do it. We will be okay, all right? Okay, this class is Introduction to Public Health. Talia Frazier, you can call me Mrs. Frazier, and my email, okay? So communication is key, especially in success for online learning, for online class, and in any classes that you take. Communication, you need to let the instructor know if there's issues or things that you don't understand. If you have accommodations that need to be met, I need to be aware of that. So within this week, I would like you guys to let me know if you need any accommodations or more time on tests, and I will accommodate. Okay, so please, please let me know. This week, we're not going to be having a quiz. There's going to be an assignment, so it's going to be the same amount of points as a quiz, but I'd like you to make sure each week you're aware where there's going to be quizzes or exams each week because it's 8 weeks. I want to make sure that you're getting understanding the information, okay? And that will be online, obviously. 25% of your grade is going to be participation, so that's activities, discussions, things with each other. I would like you to do, so be aware of that. Communication, 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 and part of that is participation, okay? Alrighty, so important dates for summer school class. June 22nd is when we begin. June 24th, last day to add in the 8-week classes, and so forth. So this you can see in the PowerPoints. This will be on there so you can review for your own resource, okay? Tentative schedule for class topics and assignments. This is just kind of very broad. It's just going to tell you what chapters we're going through, check-in activity discussion, your homework and quizzes, and papers that are going to be due, and when the final exam is, okay? And it is tentative, so things may change, things may add, just depending on how everybody's doing, okay? Tentative, right? But pretty structured. This is where we're going, okay? All right, so let's get into chapter 1, public health, science, politics, and prevention. It's so great that you guys are taking this class right now, depending where you're coming from. If you guys work in healthcare, if you're going into the nursing program, if you're going into medical school, public health is extremely important is what we've learned in the past few months, okay? So this is a very important class to be aware of. It's understanding what public health is because it's so much. It's so much to understand through science, politics, and preventing diseases, okay? All right, so learning objectives for this chapter is defining what public health is, okay? We're also going to identify the goal of what public health is, compare and contrast public health with medical care, showing public health is a combination of science and also politics, okay? We're going to summarize 3 core functions of public health, list the 3 levels of prevention, illustrate approaches of designing interventions that can prevent undesirable health outcomes. And we're going to explain the role of public health in prevention, okay? So I hope you guys are ready to learn because there's a lot of information. Alrighty, so this gentleman, CEA Winslow, provided the definition back in 1920, long time ago, over 100 years ago. He defined public health as the science of preventing disease, prolonging life, promoting physical health, efficiency through organized community efforts, also sanitation of environment, very important, the education of an individual, of principles of personal hygiene, extremely important, the organization of medical and nursing services for early diagnosis, prevention of a treatment of a disease, the developmental of social machinery, which will ensure to every individual in the community and standard of living adequate for the maintenance of health, and organizing the benefits in such fashion to enable every citizen to realize his birthright of health and longevity. So this guy was pretty smart to really define what public health was over 100 years ago. Okay, so the science and the art of public health, preventing disease, that is his main definition. Prolonging life, we want people to live longer than, our grandparents, our great-grandparents. We want to improve our overall physical health and efficiency through life. That is its main purpose of what public health really is. Okay, institution of medicine, the future of public health. Mission is to fulfill society's interests in assuring conditions with people, which people can be healthy. Organization community efforts to aim the prevention of disease and health promotion, or the promotion of health. Okay, this is our future. We're trying to help prevent disease, treatments, things like that. So this is what a main goal as public health and the institution of medicine goals are. Okay. All right, so the functions of public health, these are very important, so be aware. So first is to assess the health needs of the community. Investigate the health effects and health hazards in the community. Analyze factors that proceed and contribute to specific health problems or reduce status in communities. Okay, and you can see right here this chart, ways of how assess, assurance, or analyze, and evolve that. Okay, the core functions. Okay, public health versus medical care. Okay, this is another thing. So in medicine, the patient is an individual and the patient is in the community. So for public health, it diagnoses the health in the community using public health science. Okay, so I just want you to understand medical care versus public health. Okay, treatment of a community involves new policies and interventions. We need policy just to keep structure and to know what to follow, what protocols to follow. Goal of medicine is to cure. Public health goals to prevent disease and disability. Okay, so highlight that. Goal of medicine is to cure. Goal of public health is to prevent the disease and disability. Okay, less than 3% of the nation's total health spending is devoted to public health. Not enough. Okay, as you can tell from the past few months, how much important it is, how important public health is, and how we need to stay more on top of it. Life expectancy of Americans have increased by 30 years over the 20th century. Only 5% of the 30 years are contributed to modern medicine. So think about that. Okay, public health, science, and politics. All right, so this gets into the nitty-gritty. Science is how we understand to treat health, determine what interventions may work, and then evaluate the interventions that worked. So we're trial and error in it. That's science. We do studies, trials, we figure out, we experiment. That's the biggest thing with science. So politics, on the other hand, is more as how we as society make decisions about what policies to implement. Okay, that's the two things, science and politics. Okay, so politics is part of both policy development and assurance of functions of public health. So think about those things. Okay, think about Okay, this is what politics do, a lot of it right now. There's a lot of just high anxiety over it. But it's our society, how we make decisions by the people for the people. Okay. Community pays for public health initiatives through taxes. Okay, so also think about that. Public health disciplines. So these are very important to know because it's the different topic. It's the different disciplines of public health. So the different areas of public health. Okay. Epidemiology, we're going to talk about that with diseases, the creation of diseases, or how a disease happens and what goes on and how we figure it out. Okay. Statistics, those are the numbers. You think of statistics, stats. What are the stats on this or the stats on football? They're everywhere. They're the numbers. Okay. Biomechanical sciences, we'll go more into that. Environmental health science, social and health behavior, and health policy and management. So these are the different disciplines of public health. Very broad, a lot that goes into these, and we'll talk about them in more detail. Okay. All right, so epidemiology is the base science of public health. The studies that focuses on human population, usually starting with an outbreak of a disease in a community. So they figure out and they pinpoint, they're like detectives of understanding where the disease happened, what's going on, try to prevent spread of old or well understood diseases. Okay, so that's the epidemiology. Statistics, collecting of data on a population, it's the numbers. Okay, statistical analysis is part of an epidemiological study to seek the cause of the disease. So using the numbers from based on the population of how many people have the disease, how many people don't have the disease, and things like that. Statistical analysis is part of a clinical study testing the effectiveness of new drugs, new treatments, things like that. So be aware of statistics. You'll have to take it if you're going into nursing or any health profession. Okay, it's a tough class, but it's very important. Okay, so biomechanical science is a major portion of health disease is caused by microorganisms. Okay, and if you take microbiology, this is more in depth. Okay, but controlling infectious diseases is a major part and was a major part of public health focus in the early 1900s and in the early 20th century. Okay, and we're seeing it now how important to prevent disease and chronic disease through genetics and things like that. Okay, so being aware of this, and we'll go more into depth of each of these disciplines, but right now it's just a brush of what they are. Okay, and the disciplines. Environmental health science is a classic component of public health, which means anything that has to do with the environment, outside, air quality, water quality, solid hazardous waste, food safety, drugs, global environment, and change. A very huge topic. Again, we'll go more into that, but that's the environmental part of public health, okay, and the health science of that. Social and behavioral science is now the leading concern of factors that affect people's health. So think about this, especially right now, we're being in isolation or we're starting to open up from isolation. How does that make us feel? Okay, major health threats are tobacco, poor diet, physical inactivity, and injuries, and things like that. And so being aware of this in health behavior, social, and behavioral sciences. Okay, that's another disciplinary. All right, last one, health policy and management of health administration. So this area of studies examines of the role of medical care in public health. Okay, cost of medical care in the United States is out of control. We have seen this, we have seen the numbers, and we need to figure out a way to better budget. Okay, U.S. has a high percentage of population without insurance. Unfortunately, these people often lack the access to health care, okay, which is not good, especially if they have diabetes or infections or things like that. They're not getting treated properly, okay. All right, so public health, prevention and intervention. So we want to know these. These are very important. You're going to be learning these in your other classes. So this should be a refresher if you see it in other classes. But for us, we want to make sure we know it, especially for the quizzes and things like that. Primary prevention prevents an illness or an injury from occurring at all. So highlight this PowerPoint. Secondary prevention minimizes the severity of the disease or injury once it has occurred. So it already occurred, but we want to make sure to decrease it and not make sure it goes where we can control it. Tertiary prevention minimizes disability by preventing medical care and rehabilitation services. Okay, so we want to make sure that they're getting the help that they need when they're discharged from the hospital or to a program or things like that. We want to make sure they're taken care of. If they've had heart surgery, make sure they go into cardiac rehab. If they have lung disease, make sure they go into pulmonary rehab, making sure that they have care afterwards. They're just not, oh, we had surgery. Okay, there needs to be a plan of care afterwards. Okay, so understand this concept. Okay. All right, public health approach. We define the health problem. That's the biggest thing. We also identify risk factors and associate how the problem happened. We develop test community levels interventions to help control and prevent the causes of the problem. We implement interventions to help improve the health of the population, and we try to monitor the interventions and assess their effectiveness. So we see if these programs help through WIC programs, programs throughout the country, trying to make sure, is it helping their quality of life? Okay, that should make sense, right? All right, chain of causation, okay, how this happens, agent, host, environment, how diseases come about, traditions of approach to dealing with infectious diseases, interventions, and how it can focus on different targets, okay? This model can also be used for other kinds of illnesses and injuries, okay? Okay, public health and terrorism, events of 9/11 and other disasters have affected our public health and responses to the disasters. Natural, man-made, helps to control the damage to prevent further harm to survivors and rescuers. So that's the biggest thing that we try to do in public health, is help try to decrease all these disasters and things like that. Okay, the threat of bioterrorism did more to teach the public about public health than any educational program. So being more more educated and aware of your surroundings, aware of disaster plans. We will learn this in this class, but being aware of these issues that are happening, many issues, especially in public health, that are happening now, okay, that we don't realize. Okay, so that was chapter 1, a lot to cover, okay? And this will be in your Canvas for you to review and additional notes. Okay, let's go on to chapter 2. Why is public health so controversial? This is the biggest thing right now. So in the learning objectives for this chapter, we're going to define the mission of public health, explain public health history with social reform, identify economic impacts of public health efforts, reasons why and when restrictions on individuals are, how they happen and why they're acceptable versus not acceptable. Summarize moral and religious opposition to public health measures, illustrate ways that the federal government has manipulated the release of specific information. So these are big, huge objectives for this chapter, but I just want to get to the narrowing part of it, okay? Social justice versus market justice. So this is a very important slide to be aware of. Social justice is the common good, okay? The market is the individual's responsibility, okay? Questions about the scope of public health and how it is affecting others, especially in a society. Important of economic factors for health, political controversy. So there's a lot of political controversies with social as well as market justice. Are we getting, are we being more aware of how people are affected? Let's pay more attention to the common good versus the individual, or how important that individual is, okay? This is going a lot is happening right now, especially in this, okay? Sources of controversy, epidemic or economic impact, we've seen this, individual liberty, moral and religious opposition, political interference with science. So these are the part where public health has such controversy, and we're seeing it. And so how can we make this better? But being aware of what the controversies are in public health, and these are the major topics of how they are affecting and making it controversy in this area of public health. Economic impact. Most public health measures have a negative economic impact on people in the society. Business can often resist public health measures because they affect profit. Those who may pay may not be the ones who benefit. Costs may be short term, while benefits may be long term. Costs are easier to calculate than benefits. So we've seen this right now, okay? Or in the past few months, businesses had to shut down for isolating or stay-at-home orders. Businesses, small businesses, have been impacted, but also medical costs and things like that. This has affected us as a society, okay, and economic impact, going to work or not going to work, things like that. Tragedy of the commons. Freedom of an individual should be restricted for well-being of the population. So think of public health. Think of what's going on right now. Okay, we need to be aware of each other, but a lot of people are focused on themselves and not about the public, not about everybody else, not about their neighbors, but themselves. And so it's just such a huge controversy. Okay. When give government restrict individuals from freedom. Restrictions to prevent harm to others is generally acceptable. Plannerism is only acceptable for laws concerning children, for protections of individuals from their own actions. Okay. So it's a view of tradition and strong in the United States, common good, what affects others, or just protecting the society. Such a controversy. Moral and religious oppositions. This is a huge controversy. Sex and reproduction. This is also concerns public health are often viewed as promoting immoral behavior, where they've seen this. Just being aware it's such a big controversy in so many different areas, okay? Such oppositions may discourage scientists and funded agencies conducting research on many important health problems. So seeing different things of, you know, of science and how it can help, but a lot of people in their religious beliefs or their moral beliefs do not believe in it, okay? So this is a problem in public health. Politics versus science. There is always the possibility of tension. Obviously right now it's huge, but being aware there's always tension. Conservative control of federal government intensifies the conflict. We've seen this under the Bush administration, the Obama, the Trump, just politics in general. It causes tension. No matter what is happening, there's always tension. And so we need to come together and work with each other. And I think we are doing the best that we can, okay? All right, now we're going to move on to chapter 3, powers of responsibility in government, okay? So federal and state, this is an important slide to look over and highlight. U.S. Constitution states that a federal purpose of the government is to promote the general welfare, okay? Reserve clause is interpreted to mean that since health is not mentioned in the Constitution, responsibility for public health primarily belongs to the states, okay? We've seen this with governments. We've seen this in the states when we're opening up. How are we doing? Things like that, okay? Power to tax and spend is widely used by federal government to control public health policy. The federal government provides 65% of funding for Medicaid, and we'll go more in depth being aware of that, okay? Branches of government, federal, state, and local. So these are the different branches of government. Be aware of it. You should have learned this in high school, but also in college, just having a good refresher of understanding the branches of government, okay? Local public health agencies, this is very important. Local county and city health departments are often responsible for day-to-day public tasks, core public health functions, providing medical care for the poor. Funding sources are varied, okay? So just being aware of that. Local health agencies, state departments coordinate activities of local health agencies, providing funding, collect and analyze data provided by local agencies, manage Medicaid, license and certified medical personnel, facilities and services, handle environmental, mental health, social services, aging issues, possibly separate state agencies. So being aware of the health state departments and what they do as a society or as a department in public health. Okay, federal agencies to be aware. Click on these links. A lot of you guys should be familiar with these. Centers for Disease Control, the CDC, the the NHI, FDA, and more, okay? Department of Agriculture, OSHA, Department of Labor, Veterans Affairs, Department of Defense, Homeland Security. You guys should know all of these, but being aware. Centers for Disease Control and Prevention, the CDC is the main epidemiological and assessment agency in the nation, okay? We know this. We've seen this on the news. We've seen it as over the past few months, but it's been there for a while. CDC's Nation Center for Health Statistics collects data on the U.S. population and concerns of all aspects of health, so being aware of that. Also centers the address of infectious diseases, chronic diseases, injury prevention, other issues. That is what a major component of what they do. National Institute of Health is one of the largest biomedical research complex in the world. So look at their website. Institute exists for cancer, heart, lung, blood, diabetes, aging, health, child health, and human development, and other topics. National Library of Medicine is the National Institute of Health. Okay, so be aware of that. All right, and NIH enjoys strong congressional support. Okay, very important to know as well. These are also good to be aware of too, non-governmental public health organizations. So the American Cancer Association, American Heart Association, American Diabetes Association, Alzheimer's Association, the American Nursing Association. More of those are more professional, but be aware they're non-governmental agencies, okay? Philanthropic organizations, so they are getting funding from outside donations and things like that. Now we're moving on to chapter 4. Epidemiology, the basic science of public health. Okay, so objectives for this chapter, we're going to explain how epidemiology is used to control disease, identify some infectious diseases that are considered to be, and explain why they need to be required to be reported, steps involved epidemiological investigations, list examples of illnesses caused by toxic contaminations of food, long-term studies of chronic diseases, and how the effect of risk factors can contribute to these diseases. Okay, so big chapter. All right, so epidemiology is a major part of public health assessment. So it's assessing each person, population, investigates causes of the disease, why it happens, okay, trends of the disease and how it occurs, and evaluates the effectiveness of medical and public health interventions, okay? Patterns of disease occurrence, so who gets the disease, when did they get the disease, where the disease is occurring, things like that. AIDS, for example, how that came about, okay, where did the person get it? It took them a while to figure out how AIDS came about, okay, and we'll go over the history of that, okay. Epidemic surveillance, sorry about that, is a major line of defense in protecting the public against disease. Important terms: endemic versus epidemic, notifiable diseases, shoe leather epidemiology. System was created to control spread of known disease, but also aids in recognizing new diseases, okay? Importance of increasing with threat of bioterrorism, okay? This is John Snow. He was known to be first example of use of epidemiology to study the control of this disease, and understanding that. It was in the mid-1800s. Snow suspected a source with the water supply. So he conducted a natural experiment, and most deaths were associated with this water supply. So figuring that out and the connection started in the 1800s. All right, outbreak investigation, variation of the diagnosis, constructive working case definition, find cases systematically where they're kind of doing active surveillance, applying active surveillance, ask who, where, when, questions to describe the epidemic by a person, place, and time, consider the incubation period, and so forth. Okay, epidemiology and chronic diseases. So this is where we identify risk factors with chronic diseases. So chronic diseases are long-term. So heart disease, diabetes, those are chronic diseases, and there's a lot more, but those are examples, okay? Observe long-term trends. Epidemiologic studies of chronic diseases are more complicated and different from infectious diseases or toxic contamination, okay? These are what happens. Heart disease could be genetic, it can also be lifestyle, nutrition, things like that. Um, Diabetes, same thing, but again, it can be if they're type 1 or type 2. So think about those, okay? There's a lot of different um, combinations in correlation with chronic diseases. Heart disease, this is very important, is a leading cause of death in the United States. Lung cancer and smoking studies followed in the early 1950s. Okay? So now we're going into chapter 5, last chapter. And we're talking about the principles and methods of epidemiology, objectives, basic terms of epidemiology, how epidemiologists use their terms to describe patterns of disease and occurrence, different kinds of epidemiologic studies, provided examples of each, so we need to be aware of that. All right, definition again, the study of distribution and determinants of disease and frequency in human population. Know that. All right, defining the disease, easy to determine. A death certificate states cause of death. A blood test or stool culture is needed to verify diagnosis of certain diseases. Some diseases are hard to find, as we've seen, SARS, MS, EMS, things like that. Also, sometimes definition changes as more is learned, example AIDS. Okay, so disease frequency. Count the number of people with a disease related to that of a population. Also, denominator may be the total population exposed, exposed population, one gender, age group, things like that. 2 ways to measure frequency, incidence, this is important, new cases of a disease, or new cases. Prevalence, number of existing cases. So those 2 you need to know the differences. Used for studying causes of a disease. Okay, continuing on, prevalence is dependence in incidence and progress. So it causes a risk factor increases while incidence and prevalence increase. So risk factors increase, those 2 both can increase. If ability to diagnose increases, incidence and prevalence appear to increase. So either way, when it increases risk factor or diagnosis, those 2 new cases of a disease, existing disease increase. Okay, just being aware of those 2 terms, but how that would make sense to you. Mortality, meaning death rates, are used to measure frequency for disease that are often fatal. Okay, so distribution of a disease, who, age, sex, occupation, race, economic status. This is how we try to figure out how the disease is happening, where it's happening, when it looks from disease frequency over time, season, year, long-term trends, things like that. Is it crucial in tracking outbreak of infection diseases such as hepatitis and things like that? Where, what neighborhood, latitude, urban versus rural, national variations, things like that. Looks at comparisons of disease frequency in different countries, states, counties, and other geological factors and more. Okay, determinants of a disease. Okay, why is distribution as it is? Okay, they figure out where it's coming from. One can make the inferences from distribution. Epidemiologists, usually speak of risk factors, not causes. Okay, so genetic, environmental factors, things like that. What brought on the disease, symptoms, assessments, things like that. Human population, epidemiological studies, human population using observational rather than experimental methods. So that makes sense. They're observing. They're not experimenting, they're observing. Okay. Biomedical approaches using animal models to investigate the causes of disease. This happens to make sure for safety and other things. Experiments conducted on animals can yield clear answers as to cause and effect. For ethical reasons, experiments cannot be done on humans because it's been done in the past, immoral, just not right. Okay. Kinds of epidemiological studies, very important. So goal is to determine association between exposure, and disease and other health outcomes. Studies can be prospective or retrospective, intervention study, cohort study, case control study. So these are the very important studies to be aware of, and we're going to go through that. Intervention studies, science or epidemiologists do not perform the experiment. Closest thing to an experiment, start with two groups, experimental group, control group. Okay, watch them over time, compare outcomes. Two groups should be as similar as possible, so the intervention is the difference. Intervention studies, randomized, double-blind, placebo control is ideal. Okay, field of a trial of polio vaccine in 1954 was randomized and double-blind. Okay, cohort, very common one. Or for situations when doing an intervention study would be unethical or too difficult, consider the next most accurate. Choose large groups of healthy people, collect data on their exposures, track outcomes over time. The only difference from intervention is that people often choose their own exposures. Okay, examples, these are examples. Okay, case control, faster, cheaper are advantages of this. People who already have the disease choose a healthy control group of individuals as similar to cases. Interview them all and ask for their previous exposures. And I would like you to read and review some of this to give you guys get more comfortable with these kind of studies. Okay. All right. So we went through those chapters very quickly, but I will have activities for you to kind of feel more comfortable with. I went through it very broad because I didn't want to take a lot of your time. And I hope that you guys just follow through on each module. Email me any questions or concerns. Again, I went really fast because I didn't want to waste a lot of your time because you have a lot of time to study. So each week you should be doing between 6 to 8 hours or more, or even 10 hours a week on this class. It is a 3-unit class, but it's very fast paced. Okay, as you know, I've said around 31 chapters. We're going to have a midterm in 4 weeks and then a final exam. Okay. And a paper between that and quizzes. So I'm going to keep you guys pretty active. Again, please let me know if you have any accommodations that need to be met. And please let me know if you need any other accommodations or issues that you guys are having. Okay. Let's go back to the screen here. Okay, so we're going to stop this video. Please email me any questions or concerns. I hope you enjoyed this email or this video. Sorry. I know it was a lot to cover, but again, you have the resources. Please get your textbook, please. You can get it on chegs.com, Amazon. I sent a few emails out. I'll put an announcement too on the book. Make sure you get that. You can rent it for 22 bucks on Amazon. I think too, Chegs is around that as well. Bookstore, I'm not really sure why they're not carrying it. I think because the need of this class was needed. They didn't really update the bookstore. So please try to get your book this week. All right, I will talk to you guys soon. Thank you so much.